tell me why it's important to you. Tell me why you wanted to learn about posture.
Because I can tell when I haven't been sitting right and my shoulders hurt.
Your shoulders hurt, yeah. How about anybody else?
Low back hurts.
Low back hurts when the posture is, yeah. So posture can put undue stress on different body parts and leads to pain. That's probably the most common reason. I also have heard people say, I would like to look my best. And when my posture is good, I feel more confident. I'm also in a better mood. When I exercise, I don't get injured when I have the right posture. Right. So let's talk about that. How poor posture and prolonged sitting affect your overall health. I think, tell me if I'm wrong, I think sitting is what leads to such horrible posture in most of us. We all sit way too much. Someone said sitting is the new smoking. How often are we about, walking around doing things, bending, lifting, pushing, pulling? We don't do a lot of that. And so that picture kind of explains some of the things we've gone through. But that's posture. And that's actually what I look like when I get in front of a computer, because most of us work on laptops and the monitor is stuck to the keyboard. You can't raise it, so you go like this. And then you stay that way even when you're walking around at the grocery store. Increased blood pressure from posture. Poor posture can lead to ancient Chinese tradition said forward head posture is a sign of an early death. And now we see that people who have forward head posture, there's pressure on not just on the lungs and the heart, but also on the nerves that control the heart, which come out of the base of the neck. Increased risk of diabetes. How interesting is that? It is actually our glucose metabolism, how we process sugar, is affected by our posture. Research also shows the increased risk of disability, and that can go anyway, right? From getting injured, if you don't have good posture and you go lift something, you can get disabled. Abnormal cholesterol levels. See, everything in your body, cholesterol rises when stress increases. That's just a fact, because cholesterol is the building blocks for all your other hormones. So things like cortisol and adrenaline, epinephrine, norepinephrine, they need cholesterol. So cholesterol goes up when we're under stress. Well, posture puts stress on the body, raises that. We have increased body fat around our waist when we have bad posture. Same thing with the cortisol. Stress goes up, our fat metabolism, just like our sugar metabolism gets affected, our fat metabolism gets affected. Increased incidence of depression and anxiety. Is that really true?
Well, sitting up straight makes you feel better. Sitting hunched would do the opposite.
Yeah, you're exactly right. I want you guys to all try laughing without smiling. Can you do that?
Can't.
Not possible, right? You can't laugh and not show it. Just like you can't feel good about yourself and have your body not show it. You can't slump and drop your head and try to feel good about yourself. It's not possible. So if your physiology represents your mood can also be a representation of your physiology. You can. There's research by this. Dr. Amy Cuddy wrote a whole book called Presence, and she talks about how if you stand a certain way, you increase different hormones in your body. Increased risk of death from cardiovascular disease and cancer. Well, if it increases blood pressure, cholesterol, diabetes, and disability and everything else, would that one make sense? And then poor self-esteem, we talked about that. And could those things lead to bad posture also? Right? So poor self-esteem could cause bad posture. Abdominal body fat around the waist can cause bad posture. And depression, anxiety can cause bad posture. Recent studies report excessive sitting can lead to 91% increase in the risk of developing diabetes, 18% increased risk of dying from cardiovascular disease, 17% increased risk of dying from cancer, increased risk of lung cancer, uterine cancer, and colon cancer. Now, why do you think bad posture can cause cancer? Is it a direct thing? Is it the same as smoking? Smoking causes lung disease? And no, but the numbers don't lie, and so there's got to be something else to it. And those of you who are under chiropractic care know that when the posture is off, pressure is on the nerves. Nerves control organ function. Abnormal nerve function leads to abnormal organ function, which can lead to disease. Poor posture has a negative effect on your spine, nervous system, and overall health. We just talked about this. So based on that, you can see how a forward head posture can cause interference in the nerves that come out of the upper back. Those are the nerves that go to the heart and lungs. But also when your posture is like this, your rib cage can't expand properly. It's hard to breathe deep enough. So oxygen usage is affected. Energy. Also staying like this will wear you out. Sometimes fatigue is a result of bad posture. When you just get tired. At the end of the day, you're worn out. Well, think about it. If you had a bowling ball in your hand and you held it right here against your chest, you could hold it for a while. But if I said, I want you to hold it out here, how long could you hold that? You'll get tired within minutes, right? Same thing when your head sits forward compared to your shoulders. Everything gets tired so fast, and then you get all this pain and stiffness in the lower neck, shoulders, upper back area starts to burn. If you're on a computer and your computer monitor is not high enough, and you're holding your head like this, same thing. A few hours of that, especially if you lose track of time and you sit there for a while, now you're really hurting. Poor posture makes you look older. All right, so these are a few things. Dweger's hump is this hump right here. Double chin, pot belly, sway back. Self-explanatory. We'll look older. We don't want to look older. I wanted to show you some pictures of people who actually are older, who don't look very old. So here's one. Jane Fonda is 77. How's that posture? We actually look great if we improve our posture. It's going to take some work. We're going to do some work together, actually. I hope you brought energy with you, because you're going to stand up and you're going to work. Get ready. Did you bring towels? Okay, that's okay. Use your sleeves. And Meryl Streep, does she have good posture? Now, here's the thing. I found two ladies, and I wanted to find people in their 70s. To see good posture, see what they look like with good posture. And I wanted to find male celebrities with good posture. And I couldn't find one with good posture. I looked like Denzel Washington. I was like, I bet he has good posture. I looked at his pictures. He's got some forward head posture. And a lot of his pictures, one shoulder's higher than the other. And then I'm thinking, Sean Connery, I bet he has good posture. He's in his mid-80s. Not really. He was slumped in. And then I looked at Harrison Ford. And I think his shoulders were uneven. He had some forward head posture, and he's in his 70s. So the only thing I can do for you is this. They have good posture. So, but they're in their early 50s, So I wonder what they'll look like when they're in their 70s. But just kind of goes to tell me maybe us men don't take as good of a care of our bodies as ladies, or maybe we care less about how we look. I don't know. But that's something I learned today. So poor posture in your spine. Weakened spinal postural muscles. Right? Sometimes weak muscles will lead to poor posture, but sometimes poor posture causes the muscles to get weak. Do you know that there are, when you train a muscle, you're trying to increase what? What do you want to increase when you're training a muscle? Strength, very good. What else?
Stability.
Kind of. Stability can come from ligaments and coordination too. But if you're just training one muscle, you're trying to increase strength and what else? Think of some athletic events.
Endurance.
Endurance, very good, right? So either strength or endurance. Now, there's two types of endurance. One is, when I lift this weight, how many times can I lift it? Right? And we can count that. So, I just did 600 repetitions of that exercise. I have a lot of endurance, right? But the second type of endurance is, how long can I hold that muscle up? Or how long can I hold that weight up before I get tired? That's endurance also. Which type of endurance do you think your postural muscles need?
Second.
The second. They need to hold you up and keep you up for a long time, right? So we want to make it as easy as possible for them. So if your head's right over your shoulders, neck muscles don't get tired. If head's forward, they're going to get tired because they have to hold that weight up for such a long time. Same with the upper back, same with the low back. A lot of your postures would improve if we just put an arch in your low back. Try it right now. Sit with your feet flat on the floor. Good. Can I use you as an example?
Okay.
All I want you to do, feet are on the floor, right? I want you to arch your low back. Don't worry about where you put your head. Try to, now keep the back arch and try to slouch up here and your head. But don't lose the arch back here. Nearly impossible, isn't it?
Right.
When you improve, and so when you sit at the computer next time, or at your desk, or doing whatever, you increase this curve right here, and then you're like, I really can't mess up my posture now.
He's standing at the computer, you know.
Same thing. We can stand at the computer like this. Can you see how my ear, my shoulder, my hip, knee, back of the knee and the ankle have to be in one line, right? So the minute I lose the arch in my low back, what happens to my head? Incredibly important that your pelvis and your low back sit in the right place. It's called back force transmission. Now, if my feet are not supported, let's say my arches, let's say one arch is lower than the other, that foot will collapse in, the knee will rotate in, the pelvis will drop on that side, and this shoulder will go up. All of a sudden you go, well, the shoulders aren't even. Well, let's push that one down. Yeah, it's going to keep going up because the pelvis is uneven. All right, let's level the pelvis. No, because the arches aren't uneven. Foundation, very important. So that's why we emphasize orthotics and people have pelvic unleveling who have abnormal gait, is because once the feet are supported, all of a sudden everything above it is going to be level and balanced. We should get one for Denzel Washington. Joint stress, osteoarthritis is wear and tear of your joints, right? Arthritis, degeneration in the joints, and nerve pressure. Does that all make sense? Your spine houses and protects your spinal cord and the nerves that exit the spine. Your nervous system controls and coordinates every cell, tissue, organ, and organ system in your body. How important is it that that system is functioning without pressure and stress?
It's very.
Yeah, very good. And how does that posture look? Forward head posture and the cervicals in the neck. I mean, you can just, I can feel that spine stretching with that head being forward like that. And I told you that's what I look like if I put me in front of a computer. Like I prepared this PowerPoint, I looked like that when I was preparing it. That could be an x-ray of me. Elongated, inactive, and weak upper back muscles. So those muscles aren't really working. Right? And then you stand up straight, you expect them to work, but they're going to get tired because you've been deconditioning the muscle. When you don't use a muscle, you start to lose it. Reduced hip flexion, elongated, inactive, and weak gluteal muscles. Shortened hamstrings, right? Because your knees are always bent. These muscles get really short, and so when hamstrings get tight, they pull down on your pelvis, and you lose that curve here. So short hamstrings pull the pelvis back. This gets flat. Head goes forward, shoulders roll. You can try to straighten this up It's not going to look right unless you push this forward, just like we demonstrated. Shorten pectoral muscles, your shoulders start to roll forward, right? You see this in some weightlifters who don't train their upper back muscles. Their shoulders roll forward like this. They have a lot of muscle here, but their shoulders are really forward. And their arms are rotated. If you stand relaxed and your palms are facing behind you, you have rolled shoulders. Your palms should be, in fact, normal anatomic posture is this. So you won't see this. Most people are like this, and a lot of people are like this, where their hands actually face behind them. That's a sign that there's tightness through here. They call it upper cross syndrome. And so that's the shoulder internal rotation. Do you have a question? How poor posture creates health problems. Poor posture puts your spine in an unhealthy position, causing a shift in spinal bones. Your spine houses and protects your nervous system. Misalignments of the spine put pressure on your nervous system. Your nervous system controls and coordinates every function in your body: cell tissues, organs, muscles. This was a patient of ours several years ago, and this is an x-ray of his upper back. When you take an x-ray of the upper back, you always ask the patient to take a really deep breath and hold your breath, because you want air in the lungs. It pushes the diaphragm down, you get a better, clearer picture. Now, when we analyze this x-ray, there's a subluxation right there. His spine comes up this way and bends, and that's where the problem is, and that disc was starting to wear out. Why did we look at his spine? When he came in, he said, I have athletically induced asthma. I can't run a foot without having an asthma attack. Not 10 feet, 1 foot. I mean, his doctors actually said, don't exercise at all, because you'll die. It's very dangerous. And he couldn't get enough air in his lungs and so on, and he was overweight. So we worked on his spine. He did have some pain between the shoulder blades, postural stress. It was because of the misalignment you see right there. And we took a post x-ray after about a month of care. It's going to be hard for you to see the spine. It's actually straight compared to the sideways bend that it has in there. What you will notice very, very easily is that when he takes a deep breath, his lungs fill all the way. This is the bottom of his lung right here. That's this right here. Can you see how there's air through the whole lungs? He's able to fill his lungs. And he started to exercise. He would get on the elliptical for an hour a day. No asthma. Because we improved his posture. He's able to expand his legs, his lungs. Even if it wasn't a nerve issue, when the posture is like this, you can't expand your rib cage. So you walk around with less oxygen and less functional capacity, ability to do things. So you're going to get tired faster. Other common consequences: tension headaches, diminished breathing, fatigue, looking older, and pain. Tension headaches. When your neck muscles are contracting, try to hold you up because your head sits forward compared to where it's supposed to be, there's blood vessels that send blood to your brain that get pressed upon. No wonder we get headaches. And diminished breathing we just talked about, so lower oxygen, that leads to fatigue, but also your muscles aren't conditioned to hold you up. They're getting tired, they're getting deconditioned, and you're going to be tired. At the end of the day, you're much more worn out than you were at the beginning. Looking older, we talked about. Pain, we talked about. Three causes: structural, psychological, positional. Structural would be pre-existing conditions. It's spinal misalignments, like we talked about with the case before. Scoliosis can put undue stress on the nervous system, on the spine, on your posture. Past injuries, like whiplash. People have had whiplash, their curve gets reversed. No matter what you do, you can't bring the head back. We actually have to adjust it and realign it. Arthritis, muscle imbalance, foot dysfunction we talked about already. Psychological, depression, anxiety, poor self-esteem, we kind of talked about that. But let's actually do something. You know, with anxiety, your breathing pattern changes. Would you agree? So when you're in a relaxed state, what should the ratio of inhale and exhale be? Those of you who have read my book know this. What should the ratio of inhale be to exhale? Should it be a 1-to-1 ratio? If it takes you 2 seconds to breathe in, should it take you 2 seconds to exhale? One says yes, one says no. What should it be? Should exhale be shorter or longer than inhale? Longer, good. Twice as long. When you're in a relaxed state, it should be twice as long. Now let me ask you this. If something crazy happened and you got really, really scared, are you going to go, or are you going to go, which one? The second. Good, you inhale. Inhale is fight or flight. Sympathetic. That's anxiety. The minute our body's in a state of anxiety, you're going to inhale and exhale at a ratio of 1-to-1. Sometimes you even hold your breath. So have you ever walked on ice, like sidewalk that's icy? What do? Do you tense your shoulders? And do you kind of like, when you finally get on carpet, do you like go, and you go, man, I can breathe, you know? When we're anxious, when we're nervous, we hold our breath, we tense. So here's what I want you to do right now, do this. Tense your shoulders and hold your breath. And try to feel good. But tense, that's not tense, tense. There you go, that's tense. Right there, hold your breath. I'll tell you when you can breathe again. I'm just kidding, breathe. Who can hold their breath longer? Does that feel good? I mean, it's instant anxiety right there. So, and listen, there was nothing anxious going on. The ceiling wasn't falling, the earth wasn't rumbling, there wasn't a loud sound or anything. All you did was you changed your posture and you felt bad. So why can't we do the opposite? So stand up. Put your arms out. Palms toward the sky. Don't hit anybody. Don't hit your neighbor. Good. And tilt your head back. And just say, life is good.
Life is good.
All right, very different, right? Very different. Because you're opening everything up. And you just told yourself something good. You can put your arms down, great. Or you can stand like this, right? Put your hands on your hips, shoulders back, head back. Good. Pretend you're Superman or Wonder Woman. Right? I mean, I see smiles all across. That's posture right there. Make sense? Make yourself feel good every day. Every day, spend a minute or two standing like this. Now, what do people do when they win a race? You watched the Olympics last year? What did they do when they crossed that finish line? Do that. Put your arms up.
You should do that before you get out of bed.
Yeah. I read a book called Raising Boys, I think it's called, and it talked about how you boys, when they say I win, instantly testosterone increases in their bodies. Instantly. All they have to say is, I win. So, I walk around doing that just to stay young. So have a seat. I don't look bad for 62, right? It's all posture. So depression, anxiety, poor self-esteem, and positional could be poor postural habits and poor ergonomics. Habit is something that we need to program and reprogram in our bodies, right? Everyone has a habit. Do you guys know the 3 R's of building a new habit? Okay, this is off topic, but the 3 R's are reminder, ritual, reward, right? You need a reminder if you want to build a new habit. So if you want to stand like this every day, you need something to remind you to do that. Otherwise, you're going to walk out of here and you're never going to do it. So you can say, hey, I'm going to take my phone. I'm going to put a reminder at 10 a.m. every day. It's going to beep, and I'm going to get up. I'm going to stand like this, even if I'm in the middle of a grocery store. I'm just going to stand like this and look around. So a reminder, ritual that has to be done the same way every time. And then a reward. You need to reward yourself. So for me, I do my exercises. I do my postural exercises. You guys got a lot of similar exercises that I do myself. I have 17 exercises. It takes me 15 minutes. If I do them faster, it takes me 12 minutes, but it's roughly 15 minutes. I do it every morning. My alarm goes off at 5 a.m. I get up, I walk downstairs, I do my exercises. So, and it's ritualistic. So I start with the same exercise, I go through the same thing, do it the same way, I stand the same way, everything's exactly the same. So it's programmed. I don't need to look at my list anymore, my list of exercises. I know exactly which one comes after which one. Sometimes I wake up in the morning and I realize I'm halfway through my exercise. I go, oh good, I already did half of it, so this is great. Because it's that much of a habit. Kind of like when you brush your teeth. Don't brush just one. You gotta do all. It's the same thing. I guarantee if I blindfold you, you could still walk into the bathroom. You know exactly where the toothbrush is. You grab it. You pick up the toothpaste. If the cap is a flip or a screw, you'll do it exactly the same way. You put the same amount on. If I measure to the milligram how much toothpaste you put on your toothbrush, I guarantee, because it's a habit, it's exactly the same every time. That consistent. Habits are consistent, right? And then the reward of brushing your teeth is your teeth feel clean, and you like that feeling. So you'll do it again. So you got to reward it. So for me, my reward when I do my postural exercises every single morning, doesn't matter if it's Saturday or Sunday, my reward is my coffee. I like coffee. I love coffee. So I have a cup in the morning and a cup in the afternoon, and I do it because I need the reward. It gives me something to look forward to every single day, and it's something simple and it's easy, and I can do it every day. So I look forward to it, and I have a whole ritual with that too. With when I drink my coffee, is I got to do certain things. So, does this make sense? Are you guys gonna build new habits? Good. Examples of poor posture. So I like the one on the top left. You see how his eyes are in the center of the monitor? You see how high that monitor is? Most of us, our monitor is too low. Especially if we work on a laptop, we don't have a choice. Now, if we ever designed a laptop where you could, like an accordion, you could slide that laptop screen up, we can all go on Shark Tank, get a lot of money, and we'd be wealthy. No one has that. Or we could just patent the idea and let someone else build it. So this is okay as long as the monitor is higher. That monitor is still too low. Do you see how her eyes are not at the center of the monitor, on top of the monitor? Eventually, she's going to tilt her head down or drop her head. She needs to keep that head up. So aside from the monitor being low, this is good because the knee, the hip, the elbow need to be at 90 degrees. And even though she has heels, you see she's elevated her feet, so even the ankles are kind of 90 degrees. And her shoulders are back. Her shoulders are a little forward. You'd like them back. You've got support for the low back to create that arch we were talking about to make sure the head stays over. So many of us make the big mistake of trying to pull our head back, trying to shoulders back. But if you just tilted your pelvis and arched your low back, the shoulders would automatically sit where they're supposed to be, and you wouldn't be able to slouch even if you wanted to. Common symptoms from prolonged sitting: neck pain, upper back pain, headaches, arm symptoms and radiating pain, jaw pain, low back pain, leg pain, radiating pain like sciatic pain, shoulder pain, shoulder conditions, digestive problems, depression and anxiety. That keeps coming up. Carpal tunnel syndrome. Because you can have carpal tunnel syndrome when the nerves in your neck get pinched, when the nerves in your shoulder get pinched. They can get pinched in the elbow or at the wrist. So it's not always at the wrist, right? But if your hands are on a keyboard or on a mouse and you don't have support on your elbow, you're more likely to get carpal tunnel. One of the things we had here, see, she needs arm rests that hold her elbow there. Because if she has to hold her elbow there, she's guaranteed carpal tunnel right there. And she's still going to get pain in the lower neck and shoulder muscles. She's still going to get numbness in the hands because nothing's supporting her elbows. When your hand is on a mouse, your elbow needs to be resting on something. Because your shoulders are the only joints that are not connected to your spine. They're hanging there. They're connected to a shoulder blade, and the shoulder blade is hanging by muscles. And when you don't support that, then all the muscles on that side, on the right side where the mouse is, have to hold that shoulder blade and the shoulder where it is. And you can't do that. That's just kind of the same as taking a glass of water and holding it over your head all day. You're going to develop massive trigger points in those muscles. Those muscles are going to get knotted up and tangled up. Yes?
That's fine if you have one monitor. What if you have multiple monitors? You move it.
Your chair needs to swivel. You need to square yourself. What happens, a lot of people leave their keyboard right where it is.
Yeah, that's
They turn their monitor and look at that. The keyboard and the mouse need to go, and you need to swivel your chair. But if you just need to look and come back, no problem. Let's say if you have 3 monitors and you have 2 monitors, you square it to 1, and then you look at that and come back, that's okay. But if you have to stay there and work like this, so roughly 90 seconds is the rule. If you have to look at that monitor longer than 90 seconds, take that keyboard and the mouse with you. And then if you don't, let's say you only need to look over for 30 seconds or 45 seconds, and then you can come right back, but you always only turn this way and you never go that way because you have 2 monitors and you're facing, you have to move that monitor to the other side. So maybe the second and fourth week of the month, the monitor goes there, you know. Every other week, the monitor goes there. You switch what you use, so you're not constantly turning in one direction. Incidentally, what's the worst thing to do for your posture? Besides sitting, sitting's the worst. What else do you do for extended hours besides sit?
Sleep.
Yeah. So what's the worst position to sleep in?
Right.
On your stomach. What's the best position? On the back. Exactly. Why is sleeping on your stomach bad?
Twist your neck.
Yeah. So first off, now first thing you're gonna say is, wait a minute, all your tables, you make us lie down on our stomachs when you're adjusting us, and what are you doing? Are you ruining our postures or what? Well, first off, you have room to breathe, right? At home, when you lie on your stomach, on your pillow, you don't put your face in the pillow, right? Because you wouldn't be able to breathe. So you lie there with your head turned. And where do you put your arms? Do you drop them like this when you're laying on your stomach, or do you put them up like this? Yeah, probably more high. Good night, Doc.
Good night.
And so how is that good? Good night, Doc. And so that's one. You can't put your head straight. You have to keep your head turned. So what if I stayed with my head like this for 7 or 8 hours? Is that good for me? No. So don't sleep on your stomach. Also, your toes don't hang off the end of the mattress. Just stay pointed, which tightens the calf muscles, which is the same as wearing high heels all day. If you sleep on your stomach, your body acts like you've been wearing high heels all day. It's going to get real tight, your toes will point, and it's very bad for your feet. And actually, soleus dysfunction, which is the muscle underneath your gastrocs, causes pain right here in the back of the pelvis on each side, and it can refer pain to the jaw. Leg symptoms, did we talk about all this? Carpal tunnel and hip pain. Okay. So carpal tunnel, does anybody here have carpal tunnel?
I had surgery in both hands.
Okay, but you're good now. You're going to support your wrist and your elbow when you sit at a computer. So basically they cut this to free that nerve. But it's because all the tendons are swollen and there isn't enough space for the nerve. So instead of reducing the swelling on the tendons, which they probably try and can't do, they cut the sheet on top so that the nerve is free and there's no pressure on it. So let's try to avoid that. Core instability, exercise, and flexibility help prevent spinal problems. Common sense. Chair exercises and desk exercises you can do today. You are going to do these today. So we're going to start with the neck. And what I want you to do is you're going to do your neck range of motion. So very easy one is, some of you do this every day, I hope, is you're going to look down and you're going to bring your head back up. And when you come up, your head is back over your shoulders. You're not looking up like this. You stop here. All right? You'll do 10 of these. And you can do this at work, or you can do it like me at 5 in the morning before you go to work. Right? Perfect. And so that's perfect. So you're coming down, your chin touches your chest or as close as it can, and then your chin kind of stays in as you roll up. So it's not like this. Can you see the difference? This is wrong. This is correct.
So the motion is right here as
Yeah,
opposed to here.
correct. Correct. Very good. And then, so that's flexion. So extension is going back. So you can certainly do that one also. You can go from flexion all the way to extension if you want. I tend to be against the extension. That tends to cause problems sometimes, and especially in a seated position. So it's if you want to increase extension, I always like hanging your head back over like a roll of or a towel, or we have these foam pillows that we can give you, or on the edge of the mattress, and that to just kind of hang your head back because it's under traction. It's not actually being. So when the weight of your head is on it, extending back is not as painful. Rotations, that's when you turn and look over your shoulder. And you do 10 to each side before you do 10 to the other side. Right? Because each time you should be able to go a little further. You should do all 10 to one side. And then so Sylvia, you see how you're going from side to side? That's what I'm saying is don't do that. Yeah. Go all 10 to one side and then 10 to the others. You'll notice it'll start to increase. Side bendings, that's ear to shoulder. So, and you want to do all 10 to one side before you do the 10 to the other side, and this should not be painful. So if you feel some pain or discomfort, then reduce the range and stay in the pain-free range of motion. The best way to increase your range of motion is to do your exercise in the pain-free range of motion. Make sense? What's the best way to increase range of motion?
Stay in the pain-free.
Very good. Good. So same goes with rotation. So if you have pain when you turn all the way over, don't go that far. Go a little bit less. I don't want you to feel pain. Eventually, it'll increase to the point where you can go all the way. Chin tucks are, pull your chin in, give yourself a double chin, stick your head back. You'll sound funny too. It's great. All right? And you hold that for 2 seconds. You do it 10 times. Easy enough? That looks great. Just like that. And you may even feel a stretch in the back of your neck when you pull your head back. So chin stays in, head comes back. Very nice. Exaggeration. See, you go, this is not good posture. I don't know if I want to walk around like this. Yeah, but see, when you're doing something wrong, right feels wrong. So I had to take these, should I admit this? I took dancing lessons before my wedding. So first off, I have no rhythm. I can't clap. I fall over if like I have to clap to music. I don't sing. I have no rhythm. So this is hilarious. We were doing this song. It was a rumba song. So rumba is like salsa, but it's slow motion salsa. And I couldn't do it. I couldn't stay on rhythm. So they actually sped up the song, made it a little faster so that I could do it. So they couldn't fix me. They changed the song. So anyways, laugh. Now it's recorded. Everyone can see, can hear that. But here's my point: is they keep telling tango dancing is the same way. They go stand up straight. Tell the man stand up straight, and the man is like this. And like stand up straight, and they go like this, and they go, I am straight. No, you're not straight. And then the instructor comes and puts their hand here and here, and go this, and you go, this is not straight. But you feel like you're doing this, but in reality, if you take a picture, now you're actually straight. But when you've been doing something wrong, right is going to feel wrong, and you're going to say, wow, I feel like I'm actually leaning back. You're not. You're actually in a good place. I feel like, good night, Kristen. You feel like your head's too far back, but actually then when you relax it, it'll sit in the right place, and it'll so you have to exaggerate the motion. Make sense? So I had to dance like this really slow, and then I learned how to dance. But anyways, we'll show you the wedding video at the end. We'll turn off the video recorder, and I'll show you the wedding so you can see the dance, and then you'll really laugh. Chin tuck. So shoulders, backward shoulder rolls. Those are these. Right? Roll back and down. 10 of them. Shoulder blade retractions. How many of you know how to do that one? Show me. Nice. Very good. And you're squeezing what together? Shoulder blades.
Squeezing your shoulders
Yeah.
back.
Perfect.
It's
So what you're supposed to do is pull the shoulders behind you and pull down. What you're trying to do is put your elbows in your back pockets, basically.
So have your arms go out instead of just back.
Yeah. Rotate out, external rotation, and pull down.
Like
And
you're
squeeze your
holding
shoulder blades
something in your
together.
hand.
Yeah. Trays of tea. Don't
Yep.
you spill the tea. Not in my office. Pull back and squeeze. Pull down and back. Down and back. Right?
hurts.
Really squeeze between the shoulder blades. Right? And if it's not easy, good. Because if it was easy, why would I have you do it as an exercise? Right? It was not improving anything. If I could easily lift 200 pounds, let's say I could easily bench press 200 pounds, why would I always just go and lift 200 pounds? Especially if it's easy for me. What should I do?
Raise it up.
Challenge myself. Yeah, so I'm only going to give you exercises that are hard for you to do because that's what's going to make you better. That's how you make a change. Shoulder range of motion exercises. Shoulder range of motion exercises are similar to the neck, right? So we'll start with this one. You guys can do this with me. We're going to bring the arms up, and then we're going to swing them back behind us. So you have to be standing when you do this. So I make sure you don't hit anybody. So up, swing all the way back, all the way up, and all the way back, right? 10 times.
Nightly.
Then you're gonna hug yourself, and then say, "I once caught a fish this big," which is the truth. And then you just do it again, and you go again, and you do that 10 times. And then final range of motion is like half of a jumping jack. So you bring your arms up and back down, and all the way up and back down, and you increase mobility. These are motions we don't normally do. I mean, unless you're a chiropractor like me and you constantly have to do stuff. But even how many times do I bring my arms up like this? It's not something I do every day. How many times do you have to reach for something like this? Maybe once a day,
Unless you're short.
Unless, yeah. Then you'll have that range covered. But anyways, unless we do this every day, we lose that motion. Which is why I see so many people come in and they go, "I can't lift my arm over my head." Well, while we can do it, let's do it every day, 10 times in each direction. So front, right, side, and up like this. Those all three are very important.
When doing the hugging one, does it matter which,
Arms on top.
or should we switch it, or?
You can switch. Yeah, it doesn't matter.
That way it'll go both ways.
Yeah.
I do this every night though, especially
Good job.
arm range of motion,
Yeah.
neck and stuff.
Exactly.
When I've got mouthwash in my mouth, because I hate
There
waiting
you
that
go.
minute or so.
Yeah.
So I'm just doing it every night.
Don't waste that
My
minute.
ritual.
I like it. That's the ritual, and the mouthwash is a reminder, right? The 3 R's of a habit: reminder, ritual, reward. The reward is, as soon as she's done with the shoulder exercise, she can spit out. Yes.
I think my shoulders are doing better, but believe me, I still feel it in them. When I'm
Yeah. Well, how
I
long?
always will.
How long do you have to train to be a Mr. Olympia bodybuilder? Can you do it? Can you do it in like 6 months? No. Same thing. You're trying to change your posture. Persistent, consistent action over a long period of time. Push-ups. You can train your chest by doing push-ups, and you can do it on a chair like that, like Sylvia's doing. It's perfect. You can do it on the wall. You can do it even on something on a counter like this, where you just go out. And believe it or not, you do 10 of those. That's good. You're gonna activate these muscles properly. Triceps. You can do the same thing on a chair and with dips. So you're on your desk. You dip down and you push yourself up. Yeah, there you go, just like that.
Except the chair, the
Oh yeah, I've seen
armrest
that.
and support is too far back.
Yeah, so you would you would put your hands here. So you could do this. You go down and come back up.
Wow. Last one he didn't give me.
No.
What would
No,
be an
but these are-
alternative? I can't put weight on my wrist because I previous injury.
Yeah, can you do it? Can you? So what I would do is use like a step stool that's closer to the ground, and go on your knuckles, make a fist,
He didn't give me that
and
one.
you can do that. You also can bring your feet in. So if the closer you bring your feet to your
Do that.
rear, the less force will be on your arms. So you can make it easier because your legs will help you.
Let's see if I can get down.
Make sure the chair doesn't flip.
I know.
And don't
You
get
didn't,
cramps.
you didn't give me that one.
No, I didn't. And so it's not for everyone.
Okay.
But if you want to train your body while you're at your work, while at your desk, you certainly could do that. The next one is for legs. Chair squats. So right where you are in your chair, slowly sit down in your chair and slowly get back up.
All right.
Without clutching the chair.
You can touch. If you like, you can sit all the way down and get back up, or you can just touch and get back up. You can use your hand on your thighs to make it easier for you, or you can put your arms in front of you, or if you want to make it hard, put your arms up in the air, like this, and do it.
Yeah.
That's a lot harder, right?
Gee, let's hope for me.
Good job. Very good, Betsy.
30 pounds of shit.
Lunges. Who knows how to do a lunge? Very good. So there's three types. There's a lot of different types. So one is the one that you're doing is the most common, which is you just step forward, you lunge down, and you come back up and step back, right? And then you go the other foot, go down and come back. What I recommend is if you're doing lunges, have a chair next to you with the back of the chair towards you. So if you lose your balance, you can hold on to it. So another one is like a reverse lunge where you actually step back. I said lunge. I meant lunge. I'm getting hungry. A reverse lunge. That's when you eat your lunch with your back to your food. So you step back. So that would be this, right? Same kind of motion, except you're stepping back. Now, when you do this one, you will activate, I believe, more of your quadricep muscle. And when you do the forward one, you activate more of the gluteal muscles. So you should do both. So what I do, part of my morning routine, is I actually go back and forward, kind of like a low walk. So I'll go this way and step all the way through to the next one and then come back to center. And then I'll go the other leg, back, all the way through forward and back to center. So you can do that. You could, one thing we teach our patients is when you get more advanced, we do clock lunges. How many of you, have I given clock lunges to any of you? So pretend you're a clock. So 12 o'clock is this, right? And come back up, and then I go to 1 o'clock. And I come back up, and I go to 2 o'clock. Come back up, I go to 3 o'clock, if I could step all the way over, and go down. And then you go to 4, 5, so you get a lot of different ranges. You get all the muscles around your hips. 6, and then it gets kind of hairy because you got to go 7, it's behind you, right? 8, and then you cross over for 9 o'clock, and you come all the way back, right? And then you do the other leg. So it's basically 12 lunges with this leg, 12 with the other. You go around the clock 2 times. Seated hamstring stretch. This one's my favorite. All of you should have this one. I've given you this one, right? So slide back on your seat. Arch your low back. You do it by pushing your belly forward. Arch your low back. And then straighten one leg. Don't lose the arch in the back.
Yeah.
Put it back down.
You feel
Bring it
that?
up. Good. So let me see a big arch right here.
Feel that
There
back
you
there?
go. Now slowly.
I do.
Don't lose that arch.
Big time.
Right? And then bring it down. And do it again. So you're gonna hold it for 2 seconds. Do you all feel the stretch in the hamstring? Good. Hold it for 2 seconds. And then you go down a little bit and go right back up. Don't go all the way down. Just down a little bit and go back up. 10 repetitions on each leg. 2-second hold, 10 repetitions. Do you guys feel it? Feel the hamstrings? Very good. Yeah. So the trick is, I'm gonna go right here, John. Let me see you put a big arch in your low back. In fact, I don't want you to lean back. I want you to sit upright without touching the backrest. So arch your low back more. Arch. Don't do that yet. Arch real big. Yeah. Now don't let your back touch my hand. Don't let your back press on my hand. And then you see how you're pressing back onto my hand? The goal is not to let that. And you don't have to come all the way up. You just go till you feel that stretch. And you bring it down a little bit and you go again. 2 seconds each. It's very important to do exactly 2 seconds. So you count in your mind, 1 Mississippi, down up. 1 Mississippi, 1 Mississippi, down up. 2 Mississippi, 2 Mississippi, down up. 3, all the way to 10. And do it on both sides. The very important thing is keep the back arched. And then do your best to bring it as straight as possible. Low back. These are fun. So how many of you have been doing the Eric Goodman Foundation training? You have. Little bit. Not every day. 3 times a week. You're supposed to do it 3 times. We do it in the office at noon every Thursday. Come do it with us. 12-minute exercise. It's great. Come do it with us. We'll watch your form. We'll make sure you're doing it correctly. So the first one's called the first founder position. I'm going to demonstrate for you, and then you guys are all going to do it, and I'm going to watch and make sure you're doing it correctly. Okay? Maybe Kelly can help me. You tell people to do it correctly. Sure. So you're gonna arch your low back. Can you everybody see me? You're gonna arch your low back, feet kind of shoulder width apart, maybe a little wider than shoulder, and you bend a little bit. Hold that bend, keep this arch right here, and you slowly bring your arms up as high as they go until you can feel the muscles in your low back activate, and you hold it there. The further you bend, the harder it is. Tremendous posture exercise. It improves a lot of things. So would you demonstrate also? Check.
Yes. I know it.
So arch right here. You guys see how she's got this arch right here? And then she'll just bring her arms all the way up as high as she can. And it activates all these muscles. Right? So let's everybody stand up. And then I'll just kind of work on this side. Kelly, you work on that side. Make sure you're doing it correctly. So arch the back. And knees bent a little bit.
Back.
Yeah. And so you've already lost the arch in the back. Right? That's better. So you may not be able to go very far. Because what you're doing is you're locking your knees.
Don't lock my knees. Don't lock your knees.
So keep the knees.
That's right.
Push your rear back. Put all your
here?
weight on your heel.
Do you feel it?
And put a big arch on your back. Okay? Can you
Terry,
see
let's
that
see what you
big
have.
arch? That's perfect.
Let's see, I'm gonna
If
squeeze
you can
in
keep
here.
this. Now, can you keep that arch and bend further? Right there is good. And then slowly
Arch.
bring both arms up
Biggest arch you can
as
do.
high as you can.
And try to keep your arms
Hold it
straight.
there. Do you feel this area working?
Yeah.
Feel those
very
movements?
much.
All the way up.
You feel it up here?
So let's start it over.
So
a
maybe
nice big
bend the
arch.
knees just a little bit more and bend forward
And
a little
then
bit more.
arms straight.
Now bring the arms
all
up
the way
higher.
up.
Do you feel the low back working?
Yes.
Okay.
Do you feel it?
That's it.
Oh, yeah.
Just
There you go.
activate the low back muscles.
Yeah, do you feel it
Yeah.
right
All
here?
right, John, let's see. Arch the low back.
Wow.
Big arch in the low back.
Is that right?
Good. That's
Yeah.
perfect. Now
Yeah,
before you
you
bring your
feel
arms
it?
up, I want you to bend a bit forward
Yeah.
more.
I feel it.
Now,
halfway up my
hold
back.
that.
You have a nice big
Where do you
arch.
feel it? Down here?
That's
Feel?
it.
That's it. That's
That's
it.
one
Your
I
goal is to
had
hold that
trouble.
for
That
30
was the
seconds if
one.
you can.
You feel it? I can see that you feel it.
Still there.
Yeah.
Let's see.
I can't even.
That's pretty good.
I feel
It's
it.
hard.
Bend
It's
forward
very
more.
hard.
If you want to, bring the arms up.
That's right. It's easy if you cheat.
Very good.
I feel my
Very
shoulders too.
Oh,
Do you
yeah?
feel your low back
Yes.
muscles
Yes.
working? Perfect. So did you feel the low back muscles? Good. And you guys do that
Pass it out on
there,
us.
right?
Yeah.
You've done the video? Okay, good.
Yeah.
Very good.
Yeah, that's the one you gave me.
Good.
Very good. All right.
Oh, it's tough.
We're toughening you guys up. So next, the final exercise is called good mornings.
Oh, yes.
So everybody just say good morning, and we're done. It's similar to that other one. You have to still arch your back. You have to keep the knees just slightly bent. You got to put your weight on your heels. And you're gonna bring your arms by your side like this. You're gonna pinch your shoulder blades together. And you're gonna bend down, and and come back up. Don't lose the curve in your back. These are good mornings. You don't need to go all the way up, just about there, and you go down about there.
So what are we activating behind the knees?
Yeah,
And the
but
back?
it's
So
basically everything
what you wanna
from
make sure you do
from
is
here all the way
keep
down.
the arch.
Is
I
what
feel
you
it
activate.
here.
So the only thing
Am
that
I-
moves is you just hinge
am I
at the
like-
hips. You don't
That's fine,
bend
as
my
long
back.
as you're
Lean
keeping your back
forward.
like a board,
You
like
keep the
like
arch.
you're bending
and then
here.
just
I
move
want you to
this.
bend
So
more at the
I'm
hips.
Still keeping my chest
So-
up and
And
keep
keep
the arch.
a
I'm
lot
not doing
to
this.
It's a lot of things to remember. Yeah.
Yeah.
Like
So let me
push-up,
demonstrate what I saw you doing. So you were
stuff
here,
like that.
and I saw you
Yeah.
go like this and this and
Just
this
keep the
and this.
arch.
I don't want that. I want the whole thing
And
to
just
go.
bend.
All right, almost like from here is a solid board. That's a lot better. Yeah, but
So get your
don't bring the
really
knees
good-
higher.
There you go.
So come up.
If you can you?
Come, yeah, knees less bend. Yeah, there you go. Now bend down.
There you go.
That's it. Come back up.
There you go. And
That's
now
better.
just hinge here.
That's great.
That's
Actually,
Let
okay.
these
that
go.
looks great.
Your range of motion doesn't have to be large. It
Let's
just
see,
has
and you don't
to
have to
be
go all the way up to a standing
you-
position.
our hinging
Right there's good,
just
and you
at
go
the
back.
hip. And
Good.
this,
That's
like
it. Don't
ice,
go all the
it
way up.
doesn't-
Very good. Excellent. You guys look great. So if you do this every day, it should take you about 15, 20 minutes. And your posture will be amazing. And in fact, most of you don't need to do the push-ups and the dips. Don't worry about those. Do everything else. You'll be amazed at how much your posture changes. And it may take you 6 months to a year for you to notice a change in your posture. But so what? Let's say it takes 2 years. It doesn't matter. At least your posture's not getting worse. Everybody else out there who's not in here, their posture is getting worse every single day. Yours is going to start getting better every day. You can sit down. Things to do if you sit for prolonged periods. Maintain an awareness of your workstation ergonomics. Symptoms equal find and fix problems. So that's where I come in. I help you. And you bring me pictures of your workstation, and I'll tell you, hey, raise your monitor, raise your arm. You need an armrest. You know, most people I tell them you need an armrest, something to support your elbow. You know, and it needs to be adjustable. It needs to go with you when you know, they have really expensive chairs, like $2,000, $3,000 chairs, where the armrests actually are adjustable. They go up and down. They're spring loaded, so they're not like, they actually put a little pressure and they swivel. It's incredible. They're really cool. I sat in one once. I didn't want to get up. That would make me have a desk job, maybe. But right now, I'm glad I don't have a desk job. Maintain a consistent exercise program, which we talked about. Maintain a great alignment through chiropractic care, obviously. Our bodies are our gardens. Our wills are gardeners. Can you tell me what that means?
You want to develop your body like you would work a garden.
Yes, very good. Yeah, because you want the garden to flourish, right? Beautiful flowers and plants and roses and everything else. So our wills are the gardeners. What does that mean?
To get up and do it.
Yeah. You know, my dad used to say, your greatest power is willpower. So I tell my son now, my sons, because you know, not the 8-month-old, but the 3-year-old and the 7-year-old. The 7-year-old kind of gets it, I think, because he's the one who's starting to say, it used to be jump out of bed and go, Dad, come on, get up, let's go. But now every once in a while, I wake him up and he says, can I stay in bed for another minute? And I go, oh, I'm so glad you said that. What's your greatest power? He goes, willpower. I go, use your willpower. Get out of bed. Use your willpower. And he goes, okay, Dad, I'll get up. And I say, every time you say I will, I'm activating willpower. Right? It's the most powerful thing we have is willpower. That's no decision is made unless an action is followed by it, right? Willpower is what does that. I go, I'm going to go do those dishes. I just decided I'm going to go do the dishes. Have I made a true decision? I'm still sitting here. Unless I go and start doing the dishes, I haven't decided I'm going to do the dishes, right? Willpower. Your greatest power is willpower. Use it. It's the gardener of your spine, of your body, of your posture. And we need to be good stewards of what we've been given. We need to take care of it, and we need to use it. So nothing is more attractive than confidence. Nothing is more beautiful than a smile. You know, I say the word nothing loosely, right? I don't mean it in a strict sense. But who's the most attractive person you can think of? I guarantee you're attracted to their confidence. That's a big part of it. And so, we do all this work to improve how we look. And I want you to do that. I want you to work hard to improve your posture, because you're going to look better. When you look better, you feel better. When you feel better, you do more things. You're more active. You stay young. You stay youthful. You stay energetic. It's amazing. It's just this cascade of events that feeds itself. But you have to work on the inside too. Confidence is extremely attractive. And a smile is just unbelievably beautiful. It doesn't matter who's smiling or what the smile is, it's just beautiful. So use it. And invite your friends to our next talk, which is next month at the Common Market on heart health. Right? It's in April, and it'll be posted in the Frederick News Post, and it'll be on the Common Market bulletin board and everything else. But come to that and invite your friends, because we're going to go really deep on heart. I call it the mystery of cholesterol, or cholesterol and the mystery of heart disease, because it is a mystery. Because it used to be that they would say cholesterol reduces risk of heart disease, but then when they would do TV commercials for cholesterol reducers, it said it does not reduce your risk of heart disease. So you go, well, why should I take it? And what is cholesterol? And what does it do? And why does it go up? And why does it go down? And why is it we can't change it with our diet? We can go really deep into that. Are there supplements, foods, diets that we can use to lower our cholesterol? Are there different things we can do to reduce heart disease and risk of heart disease? Or what if we not worry about reducing heart disease, but increase the ability of our heart to handle stress? How great is that? To not worry about reducing the negative, but increasing the positive, being able to do great things. So that's literally next month. I appreciate you being here. If you want anything from the slides, we can print them for you. And if you have questions, I'll hang around for 1 or 2 minutes.
Sounds good.
Could I get a printout of the exercises, because my picture didn't turn out?
Sure.
Might as well.
Yeah.